and everyone saw Michael Phelps with those big purple circles.
Right.
Okay, that's cupping.
Right.
I know it looks really ugly.
Yeah.
But,
if you're on Facebook, about it, once every 2 months, there's an ugly cupping.
It is. It looks
photo.
like you are attacked by an octopus.
Right. Hello, and welcome to the Real Estate, Wine, and More podcast. I'm your host, Howard Fletcher. I'm a real estate advisor with Engel & Folkers, and I bring buyers and sellers of residential real estate together in the Washington metropolitan area, better known as the DMV. And in today's episode, I'll be visiting Dr. Sarah Alemi at Eastern Roots Wellness in McLean, Virginia. It is a Chinese medicine clinic, and we have a conversation about her practice and how this alternative method of treatment can be an option for those people who might not be getting satisfactory results through conventional Western means. As you know, one of the things I love about the DMV is the diversity of culture and the variety of choices that is the result of such an eclectic mix. So with no further ado, here's my visit at Eastern Roots Wellness. Enjoy. This is episode 4, Dr. Sarah Alemi, Sticking It to Pain. Okay, all right, well, I'm in beautiful downtown, or maybe not downtown, I don't know, McLean, and I'm here at the offices of Dr. Sarah Alemi.
Yes.
And Sarah, what are you? What do you do?
I am a doctor of acupuncture. I have Eastern Roots Wellness. It's an acupuncture and Chinese medicine clinic. And yes, I like to think that this is the heart of McLean, right?
Okay, well, it seems like you're here. It seems like you're here. Now, listeners to the show are used to me most of the time interviewing people who own wineries or breweries.
I saw, I listened to quite a few.
Oh, okay, great. Hopefully you liked it.
I did.
You liked it. And, but what I want to do is I want to highlight some of the things that are really great about this area.
All right.
And DC, and things that I think my listeners will find interesting. And so when I met you the other day and we discussed you coming on the show, I thought it would be really good. I don't know anything about acupuncture, to tell you the truth. Right. And I don't know much about Chinese medicine.
Yes.
So it's always a good learning. If it's a good learning experience for me, I try to make it a good learning experience for my audience. So.
Absolutely. And it's okay. I mean, I didn't know anything about acupuncture either, even after I had already enrolled to get my master's degree of acupuncture.
Wow.
So,
well, first, let's talk about how did you get here? What led you to acupuncture and Chinese medicine, and what's your background before that?
So my background's actually in public policy. I moved to Arlington to get a master's in public policy, going into politics. Was working out in Annandale for a local congressman at the time. Pretty healthy before, but afterwards I noticed I had insomnia, panic attacks, allergies, basically all the things that come with a high-stress job. So I decided, you know what, let me try something different. So I went out to Arizona. I met an integrative medicine doctor, and he said, you know what, we could run more tests, we could do blood work, we can look at x-rays, but everything's going to come back normal. Your body's healthy, but something is not making it happy. What is it? What's going on? Is there something in your life that you're not happy with? You don't feel fulfilled? And so I started pondering that, and when I came back, I was like, you know what? I want to do something different. I don't know what I want to do. But I knew that I did want to go into the health field because I had all these new ailments, right? And nothing was helping. And when I was looking online for an accredited program, the closest one was in Maryland, and it just happened to be an acupuncture school. So that's what I did.
Wow.
And 7 years later, here I am.
Yeah.
Yeah, absolutely in love with it.
Okay. So tell me let's start with acupuncture.
All right.
Okay. What is acupuncture exactly, besides just the needles, which everyone knows about? What is actually going on with acupuncture, and tell us how the process works.
All right, so you're right. Acupuncture is actually just one of the modalities of the broader Chinese medicine, right? And it's not just Chinese medicine. Obviously, there's Korean, East Asian medicine, that sort of thing. But I, in particular, practice Chinese medicine. And you have acupuncture. So acupuncture is the insertion of tiny, thin, filiform needles into specific areas of the body. Once it's inserted, it starts this cascade of biophysiological reactions. Basically, depending on where you insert these needles, you're going to turn on the parasympathetic nervous system to release different hormones, chemicals, neurotransmitters. The most common ones that are released, it's been shown, are endorphins. So pain relievers, right?
Right.
And that's why I think a lot of people, when they do know about acupuncture, they've heard that it's really good for pain relief.
Tell us something else that people would come to you for. Like, what? God, I gotta think of a good way to put this.
What can it help with?
Yeah. What's something that's uncommon or people don't know about acupuncture that it can really address?
All right. So acupuncture, it can really almost help with anything. It can't fix bones, right? It can't put your bones back in place. If you come to me with, a broken ankle, I'm going to send you back out. But it can basically help with the functioning of almost every organ system in the body. I'm trying to think. So people oftentimes they come here like, oh, I have low back pain. Oh, my shoulder's hurting. And then, so when we're doing the initial intake, I'm like, okay, well, I'm going to ask you about some other things that might not seem relevant, but they're really important. How's your sleep? It's fine, I'm like, okay, well, do you feel rested in the morning? Absolutely not. Do you fall asleep easily? No. Do you wake up? Yes. I'm like, all right, well, guess what? Acupuncture can help with sleep. Fantastic. Acupuncture, I say, okay, well, how your energy levels, throughout the day. They're like, they're okay, but they dip pretty early. I was like, well, guess what? Acupuncture can help with your adrenal system, can help with chronic fatigue. And I'm like, okay, well, let's go to your GI system, right? A big one for a lot of people. Not only because some of us like to indulge in processed foods, sometimes
they're hard to avoid.
They are hard to avoid out, even in this area, which is pretty healthy. It's pretty hard to avoid. But also in this area, people have GI upset a lot of time because of the stress that they're under. Yes. So they're like, I get heartburn sometimes, but, I'll take a pill every day. I'm like, okay. But without the pill, they're like, oh, yeah, absolutely horrible. I'm like, well, guess what? We can help with heartburn. We can help with stomach, belching, nausea. Basically, the stomach's just not behaving like it should. But some other things that can be really good with, if you have allergies, people think they have to go get shots for a couple years in a row. No. Allergies are something we can easily take care of. You have a plug nose, come on in. Right. It's something that can be helped actually really quickly. And in fact, I think you kind of mentioned earlier we were talking off air, so to speak, that, kind of cold and flu seasons right now. Yes. Some people are like, oh, I'm not feeling good. I'm going to reschedule my appointment. I'm like, no, actually right now is the time to come in for a treatment because we can help shorten the duration of your cold as well as help alleviate the symptoms naturally.
Okay, so you were giving me all of the different.
Yes.
No,
sorry,
that was
a lot.
No, well, it's very enlightening. But is it a continual treatment, or is it just a? Or I guess it depends on what it is you're treating.
Exactly.
Like for a cold, obviously you're not going to treat people past the
prolonged,
cold.
Correct. Right. So it depends on the condition, right? Is the condition acute or is it chronic? If it's an acute condition, like you rolled your ankle or you have a cold. A couple of treatments. Okay. But I'm going to want you to come in close together, like every day or every other day, or maybe come in with the acupuncture, and then I want to send you home with some Chinese herbs to supplement the treatment. But if it's something more long-standing, like insomnia, or maybe you've just had back pain for years now, right? Obviously, you've had a lot of time to develop that, so it's going to take a lot of time for us to kind of help reset your body back into equilibrium. And for that, I would start you out with maybe 2 treatments a week. Most patients just come once a week for about 8 to 10, and then we reassess, right? We see how you're doing, how your symptoms are doing, what's improved, what hasn't, and then we start spacing them out more and more. Because eventually I want you to take care of your health yourself. I don't want you to come in. Not that I don't like you, but if I'm a good doctor, you're eventually going to not have this condition anymore. Right.
What about something chronic that's related to bones, like arthritis?
Yeah. Oh, so we can actually help with that because with arthritis, right, we have kind of a deformity in the bones, right? So again, I can't, shave off part of the bone for you, but what do we have with arthritis, right? We have pain. And with pain, we have inflammation. And as I was mentioning earlier, when we insert those needles, it helps to release endorphins. We have serotonin. Basically, we have all these kind of inflammation killers that go and kind of help move the inflammation away from the joints that are affected. And they not only release these chemicals, but they help to increase our blood circulation as well, which is going to get those chemicals where they need to be.
I'm looking at some of these other services that you offer. and I don't want to embarrass myself and mispronounce them.
Don't worry.
So could you give us a highlight or what are some of the services that you would like to discuss with the listeners or let the listeners know about so they might come see you?
Absolutely. So, of course, one of the main tenets of Chinese medicine is acupuncture, though that's the one that most people know about.
Right.
But like I was saying earlier, it's just one of the therapies that Chinese medicine offers. It's kind of like a one-stop shop. So besides the acupuncture, sometimes I'll incorporate something known as cupping. I think a lot of people became familiar with it. I forgot. It was like the 2016 Summer Olympics, maybe a little bit before, right?
Yeah.
And everyone saw Michael Phelps with those big purple circles.
Right.
Okay, that's cupping.
Right.
I know it looks really ugly.
Yeah.
But,
if you're on Facebook, about it, once every 2 months, there's an ugly cupping.
It is. It looks
photo.
like you are attacked by an octopus.
Right.
But I promise you, about 80% of my patients, they actually love the feeling of it because it creates a suction and opens the pores, which pulls your blood vessels closer towards the surface, right? Which helps that inflammation move, which is therefore going to move out the pain, and it's kind of just going to let everything breathe a little bit more. And that discoloration we see, it's like because we pull the blood vessels obviously right closer towards the surface, and usually the darker it is, the more inflammation and tightness you got going on. So cupping is something that's great. We also have something called gua sha, or scraping. I don't know if I really like the translation of scraping. It sounds a little hardcore, but I promise you it's not. We use the side of an instrument. We could use something like, bison horn, right? Something that's hardcore like that, but we can also use the side of like a little piece of jade, which is actually kind of rounded. So it's not like it's a very, sharp 90-degree angle coming at you. And it helps to kind of move inflammation as well and get the blood circulating. It's really good not only for acute pains, you just had a muscle spasm, but if you have a cold or you got congestion in the chest, we'll kind of do it on the back of your neck and along your spine. It just really gets things moving out of your system. You're going to be flushing it out for the rest of the day. But some of the things I love the most, well, I should say my clients love the most, is Chinese body work, Tuina. It means to pinch and to pull. Yes. So traditionally, I would say it's a very invigorating massage, if you're going to say that, because again, we're really trying to get in there, not just the top layer of the skin, right, and the top layer of the fascia, but to the muscles and to the underlying fascia, right, to kind of release everything. And I use my elbow all the way down to my fingertips, varying degrees of pressure and strokes and techniques. I'm going with the muscle. I'm going against the muscle, which some of us, at least in Western society, aren't used to. Yeah. So it can be a little... There can be a little tenderness.
It's like an intense massage.
Exactly. I like to say deep tissue meets some stretching, right? And then sometimes I'll throw in some cupping in there as well. Okay. But for as kind of aggressive as it might sound, it really does open up your body in areas that typically aren't reached. And a lot of people still find it incredibly relaxing. I mean, I gave them some time to get up. Here's some water, and they're just kind of like sitting there. I'm like, all right, you good to drive home? So
that treatment is for someone who has like a sore back or
anything.
What?
It's really good for any kind of muscle pain, but it's also really good if you have it's like a jump start. It's like jumper cables, right? There's something in your body that's not functioning properly. I'm going to work on you with a focus on the area and see if we can't get the body functioning better.
Okay. All right.
And I love it. And then I think also a lot of other people, particularly in this area, usually they get excited and ask for my card when I tell them I also do cosmetic acupuncture.
Now tell me about that.
Yes.
I didn't even know such a thing existed.
It does. It's basically like, so there's like cosmetic acupuncture. Some people call it facial rejuvenation. So I still do a whole body acupuncture treatment, right? But the focus is on making your face, look more renewed, both by working on the outside and by helping the inside go better as well. So
it's Botox without the drug.
Yeah, it's like a natural facelift, right?
Right. Okay.
I have, I think maybe about 50% of my patients come in for cosmetic acupuncture treatments.
Wow. So how long does that take usually, that treatment?
The first time, 2 hours, right? Because I want to have a good consultation. I want to ask about your diet, your sleep, because those are things that are all going to show up on your face. And I also want to know if they do have a history of thyroid problems or GI upset, right? Because again, we want to make sure those things are functioning properly. So the good the blood can circulate to the face, right? So your cells are turning over. But then I also, I sit down, I kind of help wash it. I use like a microderma roller to kind of open the pores, get rid of the old skin, and then I'll insert needles into the areas of concern for that patient, but also into areas that are really well known to kind of help tighten the muscles, like into the muscle insertions, right? It's kind of like telling them, hey, we're not done yet. We're, like tighten back up. And then so I leave that for about 30, 40 minutes and then come back in. And depending on the patient, their sensitivity, right, I might do some facial cupping as well as some facial gua sha, which helps to get the skin and the blood and the lymphatic system. It helps to turn those on even more. And then follow-ups are about an hour 15 to an hour and a half.
I've heard people say that they've used acupuncture to address some behavioral or addiction issues, such as smoking.
Oh, absolutely.
And maybe eating or overeating and that type of thing. Now, do you do that?
I do. I am an Acu-Detox specialist, actually.
Okay.
So one of the other things I do is oftentimes people, when they come into me, actually a lot of my cosmetic acupuncture patients at the same time, they're like, okay, I want to start the year off right, or I want to, get back into health. So besides helping them look good from the outside, they're also asking me to help them like with their weight, right? And sometimes with weight that kind of is an addiction, or maybe they're smoking and I'm like, that's really drying out your skin. So I'll help with that. And what's known as auricular acupuncture, or use of points in the ear, are really good for addictions, for withdrawals, I guess what you would call kind of more psychological habits or behaviors, right? And as an Acu-Detox specialist, that means I was certified by NADA, the National Auricular Detoxification Association. There's a protocol where you use 5 points each ear. You might have seen people doing this in community center settings, or I think the VA actually even has acupuncturists on staff who use this for treatment for the soldiers, right? Veterans who have like PTSD, that sort of thing. It's really good. And in fact, I always use at least 2 ear points on every patient that comes through this door. It just helps to reset your nervous system and activate that rest and digest.
So everyone who comes to see you can bet on their ear being addressed.
And I usually start with it because it's probably the least pleasant. So I say
pretty sensitive, yeah.
Exactly. It's very sensitive, but then again, think about it. I mean, it's directly connected to our nervous system.
Right.
I mean, that transmission rate it's phenomenal. I mean, I think I had a new patient the other day. I mean, luckily I know them coming in for high blood pressure. I put in those points on the ear and she's like, I think my blood pressure just dropped really quickly.
Wow.
So I was like, all right, let me take him out for a second, let you sit, and then we'll put him back in.
The reason I asked you about, I would have asked you about arthritis anyway. However,
yes,
in my personal life, my mother is 89 and in really great health for her age, except for she has bad arthritis in her knees.
Oh, okay.
And it didn't really flare up until past 80, And so she's past the point where, doing something like knee replacement or something that evasive would make sense.
Right. It'd be really hard on her body.
Very hard, very hard. So what would you, for someone like my mother, what would you recommend as far as Chinese medicine and acupuncture? And how often would somebody, obviously it's case by case, I understand that, but I'm asking really for the benefit of my mother and also for some of our older listeners who might say, God, that sounds good, but I don't know if I have the time to invest in to see you. So
understandable. Well, I first want to make you and any of your listeners feel comfortable in knowing that acupuncture is not, a crock. In fact, the NIH recently, I don't want to say recently, 2016, they put out a statement saying that acupuncture was the #1 treatment for low back pain and osteoarthritis of the knees. Get that, right?
All right.
And so when someone says they have knee pain, I say, come on in. I don't know what it is about the knees, but they really do respond very well to acupuncture. I don't want to say I love it when a person has pain, but if they do have pain, I'm like, fantastic. It's in the knees. I'm super confident in that. It's like I said, I don't know, maybe because of the arteries and all the tendons behind the kneecap, right? A lot of those, they go right up the spine to the nervous system, but it's very effective acupuncture. For your mom, I would want to know like how debilitating the pain is, right? If she's thought about having replacement, I would say it's probably pretty uncomfortable. I would want her to maybe come, if she could, ideally 2 to 3 times the first week. And I do understand a lot of my patients, they have lives, and I want them to balance health and happiness and not be more stressed thinking about coming in. So I would say come once a week for about 5 or 6 sessions, and then we'd reassess. And then with the acupuncture, I may or may not do what's called electroacupuncture, adding a bit of electric stimulation, because that's basically like if I were to stand in the room twirling the needles the whole time, right? It's just a little, it's a little bit more stimulation, but because it's electricity, it's going to be more even and controlled than if I were doing it myself. And it also allows the patient some downtime because I'm not standing over them. She's a little bit older, so I may not do cupping, but a lot of people will do cupping to get the blood moving around the area. Sometimes I'll do moxibustion. That is the lighting of an herb. So it's really nice and warm. You know, like if you put like a heating pack on a joint that's aching, it makes it feel really good. So I might do some of that to help get blood moving as well, either before or after the treatment. And then I may, depending on if she's open to it, send her home with some Chinese herbs. I like to use pills. I know people really love, they like to say, you know, obviously the teas are maybe more effective, but not, a lot of us don't have like, you know, an hour every day to cook teas. Yeah. And they are quite bitter. So I usually just do the pills.
Okay. She drinks a lot of tea. But,
well, that's fantastic. Tea is fantastic. Yeah, I would ask her which ones she drinks, and then I'd say, well, okay, you know, like green tea has a lot of anti-inflammatory properties. Fantastic. So we would just encourage her to keep drinking those.
Okay. All right. Well, you may have a new client coming in to see you.
Absolutely.
sometime.
And like I said, it's I just love it because there are so many different tools that I can use for the same condition.
Okay. Well, in wrapping up,
yes,
I'd like you to. You know, is there anything that I didn't ask you about, or something that you'd like to mention that that could take just a short bit of time, and also let our audience know how they can get in touch with you and moving forward.
All right. So, well, I mean, you know, Chinese medicine is about 5,000 years of medicine. So I'm not sure if there's a whole lot.
Boil it down into 2 minutes, okay?
So I would say the fact that it's been around for 5,000 years and people are still practicing has to say something to its effectiveness. And the fact that other types of healthcare providers are now offering acupuncture has to say something to how effective it is too. So, I mean, if it's something you want to try, I would definitely encourage it, you know, and we're going to switch things up. And if it's not for you, fantastic. But you can say you tried, and at the very least, it's natural, it's effective, and it's safe. And if you want to get in touch with me, you can go to www.easternrootswellness.com. Again, that's Eastern Roots Wellness. I'm in McLean, Virginia. I'm pretty good about getting back to you. So reach out to me however you want.
Okay. All right. Well, thank you, Sarah.
Well, thank you for having me.
I appreciate the time. I will... Well, I'm going to look at some of your roots. You know, you mentioned that we were talking beforehand about addressing colds.
Right.
If I hope I don't sound like it, but I am suffering from my first cold in quite a long time. And so we'll probably discuss that too.
Yes, we will.
All right.
I can't let you walk out without talking to you about it.
Okay. All right. Well, thanks a lot. And I'll be back. Bye-bye. Well, that's it for another episode. I'd like to thank Dr. Alemi for being on the show. If you have an interest in learning more about Chinese medicine or acupuncture, please contact Sarah Alemi at Eastern Roots Wellness in McLean. I'm sure she'll be able to answer any questions you might have about how her practice might fit into your life. Listen, I would love to hear from all of you. If you want to contact me about real estate or this podcast, please email me at howard.fletcher@evusa.com. My contact information is in the show notes. Something that you can do that would help me loads, especially if you're listening on Apple Podcasts, Spotify, or iTunes, is to please rate this episode and also subscribe. And if you like it, tell your friends about it and ask them to give me a listen too. I would very much appreciate it. I want to grow this podcast as much as possible. I'm trying to take over the world. The Real Estate, Wine, and More podcast is a production of the Fletcher Group Incorporated, made in association with Engel and Folkers, Tysons and Lansdowne. Music for this episode was supplied by Cadillac Grip. If you're ever in the Boulder or Denver, Colorado area, please go see Cadillac Grip play. Because if you ain't hip to the grip, you just ain't hip. The Real Estate, Wine, and More podcast was written, recorded, engineered, produced, and screwed up by me. I'm Howard Fletcher. your friendly neighborhood real estate advisor. Thank you for listening. I'll see you next time. Have a great week. Bye-bye.